welcome everybody to the December 16, 2021 Flathead City County Board of Health meeting. Nice snowy day. It's good to see that. So with that, I'll meeting to order, and Janelle, if we could have a roll call attendance, please.
Artist?
Here.
Annie?
Here.
Bill?
Here.
Jessica? Kyle?
Here.
Pam?
Here.
Pete?
Here.
Roger?
Here.
Ronaldine?
Here.
All right, with that, I guess we're short Annie and Jessica today.
Oh, Annie.
Oh,
Zoom, yes.
oh, I'm sorry. Okay, great. Okay, with that, we'll move on to the approval of the agenda. Is there any modifications or revisions to the agenda? If not, I take a motion to.
I'll make a motion to approve the agenda, the meeting, December 16th.
Second.
I'll second that.
It's been moved and seconded to approve the agenda as provided in the board's packet. All those in favor say aye.
Aye.
Any opposed? Okay. With that, we move on to citizens' comments. So we did receive a number of written comments, and I looked over them. I hope everybody got the chance to look them over. There were some that were very appreciative of the board's efforts, and it's nice to see that acknowledgement once in a while. So with that, we hope everybody else had a chance to read them. We'll also take verbal comments from the public at this time. So if when you come to the podium, please state your name and address, and we typically allow about 3 minutes for your presentation or your discussion.
So good morning, my name is Hannah Carrera, I live in Carla, Montana. So I'm glad I could bless you with my presence today. Good afternoon. Basically, I want to state that I wouldn't be here today if the people I elected did what they were elected to do, what they swore an oath to do. And that is uphold the laws of this nation, the principles and Declaration of Independence. So, and instead I get a lot of sitting back and doing nothing and a lot of excuses, and this is all related to COVID and other issues surrounding that. But I'm not going to sit here and argue about statistics and the lies that come out of this department. I've been here before. I've been here before. I've written lots of letters. So most of you are proving yourself to be immune to critical thinking, analysis, and scientific review. And the reason I say that is because the truth can always withstand scrutiny. And that's why you work so hard to overpower and censor those that see through your lies. Let me start out by giving you a few examples. And this is nationwide and it's generational. So first of all, there is no war on terror. There's no war on poverty. There's no war on drugs. And there's no war on COVID. There's only a war against me and you. The borders are wide open. Government agencies are exempt from the same mandates they push on upon the citizens. The government helps poverty by inflation and other regulatory means. And basically the government creates these situations, basically so, and they blame it on the citizens. And they get more power. The solution to every societal problem, every individual problem is less individual freedom, more government power, and more money. So what if? So what if? There is no if. So let's start with the current one. So this is COVID-19. Okay, so I'm not saying it's not a disease. We don't know much about it because there's so much misinformation out there. And the misinformation is not coming necessarily from people who, like myself. The misinformation, as we've proven, and we can prove, and I'll sit here and testify under oath, and I challenge all you to do the same under penalty of perjury. So COVID-19, I mean, it has a purpose. And what's the purpose? It's part of a bigger purpose. That purpose is to institute and bring about Marxism, socialism, and whatever kind of authoritarianism you could come up with. And evidence is all around us. So COVID-19, what happened in COVID-19? So we get a virus, and then we get a vaccine, a rush to market vaccine. A virus that is non-lethal to most healthy people. A virus that's almost 100% survival. And then we get an authoritarian overreach. But every single government agency on the planet here, it seems like. And then when citizens like myself, who you're supposed to respect, say, wait a second, let's ask some questions. We don't have all the data. This thing was rushed to market. So why do you want to inject people? So, what is the rush? What's the push so much? And I think there's a few things, a few speculations and everything else, but it doesn't matter. You're not interested in hearing those. Not at all. The propaganda coming up from the CDC is nothing but Chinese communist propaganda. If I come up with any contrary evidence to refute that, you refuse to look at it. And believe me, I've given you all plenty. And I've given the governor plenty, and I've given everybody else plenty. They're not interested. Why not? Does a lie pay more than the truth? Obviously it does. So this is what happens when you allow lies big as COVID to propagate. You build policies upon that lie, more lies build upon that lie, and pretty soon you're left with nothing but lie upon lie upon lie, and the lie becomes the truth. And that's classic cultural Marxism. That's what happened to Black Lives Matter. That's what happens to all this racism. It's all the same thing. If you're so worried about stopping the spread of COVID-19, why aren't you worried about the people coming in across the southern border? By the millions. The millions. No, instead you're worried about putting the reins around citizens like myself and everybody else. So, like I said, the truth, America's going through a cultural, political, and economic revolution. And it's going against that revolution against the will of the people. We didn't want that, but it was thrust upon us. If you think you're going to be immune by participating, then you obviously are ignorant to history. You too will be caught in your own web. You'll suffer along with the rest of us. If you're not willing to call out your enemy, and this goes for all the Republicans and all the Democrats and everybody, whoever you are, call it out. I'm tired of these word games. I'm tired of all this crap. This little tiny, these niceties, this falseness. So I want to know who I'm talking to. So we obviously have a cultural Marxist revolution going on. It's happening in our public schools, and you're pushing, not necessarily everybody in there, but a lot of people are pushing all kinds of sexualities upon our children, and forcing them to get vaccines or coercing them to get vaccines. What does a kid need a vaccine for that he's 100% immune to? What's the point? I want to know. Nobody can answer me that question. So we need to have this discussion, because if you can't face your enemy, if you can't call out your enemy, then you're not qualified to confront your enemy, and you're certainly not qualified to defeat them. So now is the time, and this is the hour, and this is the hill to die on. I'm not giving the state any dominion over my body, and I never will. So, and if you do, you forfeited every freedom granted by God. And as far as the kids and the infants, now the push to vaccinate infants is inexcusable and intolerable. If you don't stand up for this, you're never going to stand up for anything safe. Doing the right thing requires sacrifice. If it comes easy, likely it's not the right thing. And what's going to come upon our society, I can tell you. Look at Germany, look at Australia, look at Austria. The police are rounding up people, throwing them in prison, beating people up. Not much different than happened in the 1930s, 40s, 50s, all the way through every totalitarian state. But we give us a pass now because it's in the name of health, right? So, and that being said, COVID has a purpose. Like I said, it's to concentrate power and resources from the individual to the government. I've never seen America ruled by such mindless, weak, self-serving, and mentally ill opportunists. And I'll give you an example. The world forever has been ruled by psychopaths. And you can laugh and you think, what's a psychopath? Well, they're everywhere. So here's some examples of their behavior. Pathological lying and manipulation. We have that every single day in Congress, every single day in our county government, every single day in our city government, all the time. The CDC has been caught manipulating and altering data. Nobody cares because the end justifies the means. That's the trait of a psychopath, okay? So the lack of morality and rule breaking, no matter what the agenda, no matter what, it doesn't matter who gets hurt, who gets stomped on. The state, it has to be superior. So people's individual freedoms, people's jobs, people's lives, their way of life has to come second to all that. The lack of empathy and cold-heartedness. We see this everywhere. Policy first, screw the individual. And this is probably one of the biggest ones, narcissism and a false sense of superiority complex. Everybody in here and everywhere else in city councils and stuff like this looks down upon the citizen. We know more than you, you know less than us. We're the administrators, and that couldn't be further from the truth. I don't think anybody really has an idea of what's coming your way. And what's coming your way is what you can't even imagine in your worst nightmares. Complete totalitarian state. Look around the world. It'll be here in a year or two. And then the other thing is gaslighting and psychological bullying. So projecting the blame. So they do things themselves and then blame it on others. And it's classic of any Marxist or any totalitarian or anything else, is that you blame others for what you're currently doing. And perhaps one of the most insidious forms of antisocial personality disorder is what may be termed as situational sociopathy or psychopathy, where an individual extends cordiality, respect, and regards towards some, but exhibits inhumanity, harshness, and cruelty towards others. You know what I call that? Political correctness. It's everywhere in society. So if we had real statesmen, real independent thinkers, we'd have robust debate. Instead, we have lies, deceit, and those that enforce it. And we have excuses from our county commissioners. And instead of listening to citizens, listening to this, it seems like whatever the state says is fact, and wherever the money comes is the truth. So let me give you a couple of things.
Ms. Travel, we
Yep.
allow 3 minutes and you're at about 10 minutes now, so I'll give you 1 minute to wrap
All right,
up.
I'll wrap up. So a couple of things. The vaccines are not safe and effective. They're not fully approved by the FDA, meaning fully licensed. The unvaccinated are not spreading the variants. And the majority of new cases and deaths are among the vaccinated. And as far as giving dominion to our bodies and everything else, like I said, you crossed my line. And I never intend on giving in no matter what becomes law and what doesn't. The only way you ever stick a vaccine in my arm is in my cold, dead, rotting corpse. I'm not gonna let that happen easily.
Thank you. Is there anyone else in the audience that would like to speak to the board?
My name is Rod Kern, 611 3rd Avenue West, Kalispell, Montana. I will be joining this board next year. And I just wanted to take this opportunity to introduce myself so you could all see there are no strings attached to me. And my daughter had on a refrigerator, I campaigned, obviously, as you know, for city council seat and lost in this last election cycle. But my campaign postcard, my 3 points were I wanted to preserve, protect, and provide. And it was preserve our community, protect our environment, and provide opportunity for all. And those 3 things I bring to this board, not to the city council, but to this board. And it aligns with the mission statement of the City County Health Board. So I look forward to serving. I do have to jettison out today because I have obligations as a grandparent to pick kids up from school. And I don't want to miss out on that, but I did want to introduce myself and just start off on that. But thank you very much for your time.
Thanks, Rod. We'll look forward
Thanks,
to
Rod.
seeing you. Carter? Yep, go ahead.
Hey, everybody, it's gonna be I'm Don Barnhart from City of Tony Falls. I'll be joining you guys in January. I've been serving on boards starting in 2003 in the city. I've been on planning boards, board of adjustments, and been a long time mayor. So I'm gonna follow the law. I will tell you that. When I see something that I see goes against state law, I will speak up. I have a long history of doing septic work, septic system installation designing. And I think I can bring that to this board. I'm hoping. The rest of it, I obviously don't have a medical background except I was an emergency responder. So hopefully I will get to know all of you a little bit better. And for the next 3 years, you'll see my smiling face around here. So again, thank you. I look forward to it.
Thank you. It sounds like you have great qualifications. All right, if there's no one else in the audience, we'll move on to the Zoom public comment.
And the first one is Jessica Perkindale. If you're on, can you please unmute yourself? Jessica? And the next one would be Sharon Stratton. If you are online, can you please unmute yourself? I do not have any other ones.
All right, with that, I guess we will conclude the public comment section of our agenda and move on. Because there is one thing I probably need to back up, and should have mentioned this at the beginning of the meeting, is that we do have a number of items on our agenda, decision items on our agenda today. And if I guess I need to just make sure nobody on the board has a conflict of interest with any of those items. And
Mr. Chairman, I do. It is the variance. And so I will be stepping down and I'll leave the room.
okay, so let the record know that Artist Larson will recuse herself for the variance portion of the meeting. Thank you. All right, we move on to the approval of the November 18, 2021 board minutes. Are there any corrections, modifications, revisions to the minutes?
Hearing none, I move adoption.
Second?
Okay, it's been moved and seconded to accept the board minutes of November 18 as provided. All those in favor say aye.
Aye.
Any opposed? Thank you. Okay, we move on to item 6, cooperative agreement between the Department of Human Health Services and Flathead County Board of Health for 2022. Joe.
Yeah, Roger, I think at the last meeting I mentioned this will be coming back around pretty soon, and it did. So it's literally just needing authorization for you to sign the document. We'll return it to DPHHS and be ready for next year.
I think we had a discussion on this last meeting.
Yeah, I think you can.
But
I just have one question. Is there any change in the document or any anticipated change in the department as a result of changes?
None expected, none anticipated.
good question, though. Thank you.
I move adoption
Okay,
or authorization.
it's been moved to have the board chairman sign the agreement. Is there a second?
A second?
Moved and seconded. Do we have a roll call vote, please, Janelle?
Artist,
Yes.
Annie,
Yes,
Bill,
Yes.
Kyle,
Yes.
Pam,
Yes.
Keith,
Yes.
Roger,
Yes.
Ronald.
Yes.
Okay, thank you. It's unanimous decision on that, so we'll move on to the next memorandum for variance request. I guess this ours is where you can keep part.
We'll come back to that.
All right, we have a variance request on a environmental health issue. So Joey, want
Yeah,
to just lead us?
yeah, kick it off. This is a lot, Whitefish Lake, in the back, what I call the backside of Whitefish Lake, notoriously high groundwater area. These folks have purchased the property and want to upgrade their septic system, pretty much remodel their property. To that end, we usually find no objection because we can get a much better wastewater treatment than the stuff that's sitting in there connected to the old cabin. This is once again very similar to last meeting. You know, the site was monitored and the groundwater is very shallow there. And before I go any further, Jeff Larson is here, representing the Bees, Richard Beanie. And Jeff, if I miss anything, you'll be sure to correct me, right? All right. So groundwater's really shallow here. I want to find the exact groundwater limit, and then we're finding it right now. But it's 25 or 23, because I know it adds up to 48. One of those is right? So Jeff has designed a system that's put more sand underneath the mound to get that separation that we require in our regulations at 48. I don't have a lot to add. I'll come back when we need to do the findings, but Jeff, is there anything you want to add?
No, I don't think so. That's a question. I think more than my answer.
And turn it to you, Roger.
Okay, with that, the environmental subcommittee did hold a meeting and reviewed this application of this variance on December 3rd, and we reviewed all of the plans and design drawings provided by Larson Engineering, and it conforms with and is in the best interest to move ahead with it. As with before on these variances, there's two parts to them. First part is we acknowledge the findings of fact or approve the findings of fact. And the second part is we approve the variance. So the findings of fact in our packet on this is basically labeled conditions governing variance. And all of those were affirmative recommendations. Does anybody have any questions on that relative to the board? The subcommittee approved the variance at that time. I'll open it up to the board if there's any additional questions, but the recommendation from the board is to, or from the subcommittee is to approve the findings of facts and approve the variance. That any questions?
This is too serious to ask the question. Is the conflict of interest matrimonial or technical?
Both.
I knew.
He's really in trouble. So with that, I guess, is there a motion to accept the findings of facts for the Richard B. variance request?
I would move to accept finding facts as presented for the variance request for Richard B.
Is there a second?
I second.
Okay, it's been moved and seconded to accept the findings of facts for lot 5, Point Inez Villa Tracks at 737 Delray Road, Whitefish. Janelle, would you do a roll call, please?
Yes. Annie,
Yes.
Bill,
Yes.
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronaldie.
Yes.
Thank you. All right, so the findings of facts have been accepted and approved, and we need a motion to then approve the variance.
I move to approve the variance request of Richard B. as presented.
I second.
Okay, it's been moved and seconded to accept to approve the variance, Richard B. variance request. Any questions? Janelle, would you please do a roll call?
Annie,
Yes.
Bill,
Yes.
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronaldie.
Yes.
Thank you, guys.
Okay, thanks, Jeff. Good job on your application. Thank you.
Just a question. This, I mean, seems pretty similar to the same issue that we dealt with at our last board meeting, similar variance. Is there any thought on more of a legislative level about changing the rule when it comes to groundwater in some of these states? Or is that, I'm just out of curiosity, because is this going to continue to be an issue as people are renovating these low groundwater or these groundwater areas?
I'll let you respond.
Yes. It's gonna always be an issue on replacement. Was it about 6 years ago, I believe, that the board got tired of hearing some of these for replacement. So we do have a waiver system, but it was actually at that point, I said, groundwater, surface water for replacement still need to go to the board. This is, basically because of the findings and the board making the decision. But Pete, this is an age-old issue. It is only, you only see these for replacements because new can't basically make the grade. You will see some very few variances on brand new construction, very few. But this happens a lot because of construction standards changing. But it would, the board does get tired of hearing these, but because of the gravity of this, as it relates to new systems, it really does need to go through this process. And we'll continue to streamline it as much as possible.
Yeah, I mean, I don't have problems learning about it, and because that's not certainly what I've been doing, but I'm just curious. But so it's going to just continue as far as these replacements as along the lakes and things like that.
It's clearly going to be anything that encroaches on surface water, groundwater needs to come to the board. Yeah, it's a very important
Yeah,
process.
understood.
The other aspect of that is the 48 inches of separation is in both the county rules and the state rules. So it'd be very difficult to change that.
I mean, not that we want to, but I'm
Yeah.
just curious. Okay.
I guess Kate Cassidy's in the audience too. Do you have any comments relative to that, Kate?
No, I don't see any changes coming our way from the DEQ.
Thank you. Good question. So, all right, we'll move on to the SOQ for the septic treatment and biosolids composting. I guess, Joe, you can start that off.
Yeah, I'll kick it off. So at the last meeting, the board kicked so we started a request for qualifications to hire a firm to look at septic treatment and the biosolids composting side of things. We at that time, we acknowledged that the SOQs, the statement of qualification, which is the product of what we desire, would go to the Environmental Health Committee for review. We did meet this week, yesterday, actually, right? And we met with HDR. And I think I've sent you an email earlier. The only one who may not have got it was Artis. Something's going on between my email and Artis's. But we did receive one statement of qualification, and that was from HDR. As mentioned in my email, that's not surprising because this is not, I had firms call me, and when they found out HDR was in the mix, they said, we don't compete very well with HDR. And I didn't think they were going to spend much time putting things together. So I was a little, but not very surprised we only received one statement of qualification from HDR. I believe Artis and Roger would agree that this is a firm that does have the requisite skill set to perform this type of work. Before we open the discussion, I believe that the point that we need to go now moving forward is to have a discussion on how this might look moving forward with HDR as our firm to do this design work. And I'll kick it back to you for that, Roger. But I think that the committee and the health officer would like to move forward with HDR.
Well, I guess just to preface that a little bit too. So I saw after I sent out, there was a little synopsis that HDR put together for us. I sent it out, but I think so Joe had sent it out too. So I don't know if everybody got to read it, but it was just a one-page summary of how the process, what their analysis consisted of. They had done about 20-page report for us, and that was kind of the basis for moving forward with this project. And I guess to back up a little bit, just to describe it, so the problem at hand is that all of the septic haulers right now, they use land application for disposal of the septic and or biosolids. And with the price of land going up and the limitations with neighbors and whatnot, that's getting to be a pretty finite resource. So we have to start looking for an alternative method, treatment or disposal, and that's what this biosolids project is about. And we're also have ARPA money available to start this project. So as Joe mentioned, we went out for a statement of request for statements of qualifications. We only got one submittal, which Joe said wasn't surprising given their HDR's experience. And so we recommend, the environmental committee does recommend accepting them as the lead consultant on this. They gave us a little presentation yesterday. They've done biosolids in Coeur d'Alene, Hamilton, and other places in the state, these treatment facilities. And so they do come with a substantial amount of experience. So I guess that is the recommendation the environmental subcommittee is putting forward. And so that is an action item, I guess.
Yeah. We, as mentioned, Roger and I will work with him on how the details, because this is ARPA money and it is in the counties, even the DNRC funds. So there's $2 million that we received, were rewarded. There's treasury money that the commissioners are being rewarded. I guess I can say rewarded instead of awarded. So we have a $2 million money from the DNRC, Montana DNRC, for this purpose, and it was expressly for this purpose. So the money's in the bank, but it is controlled by the commissioners. And based on the changes in the legislature, I would strongly recommend to both boards that the subject matter expertise on our board, we should manage the project, but the commissioners should not manage the contract. And I think that's a good way of looking at this, but the details, we haven't had a chance to look at the details from HDR and with the contract. They want to do a master contract and then do phases underneath it. We need to sit down with Pam and probably Pete, just talk about how this should look. Right now, we really are looking forward to, action that says, yes, we'd like to move this forward as a project. And that's all we really need right now.
We just got the contract today, so nobody's had a chance to look at it or review it, and it's certainly going to be under the commissioner's purview to do that and administer that. So yeah, we're just looking for a recommendation to move forward with the next phase, which would be bringing HDR on board as our environmental contractor for this project.
Will be a consultant or a contractor with us?
No, they're a consulting firm. They're a large consulting firm. I don't know where their total main office is, but the Montana office is based in Missoula. And they do have people in the Flathead. There's a couple people, one in Big Fork and one in Whitefish, that do the field work for
So it's like design and consulting and design?
design, engineering design type firm, yes. It's not a build, it's design.
And what's the approximate cost of this initial phase?
I think that this first phase, identifying the site and literally, it's a little bit of a misnomer, and a 30% design, which is really 80% of the work, is I think they projected conservatively at $600 yesterday.
Yeah.
That's what they called out. So 600K for basically getting us a site and all the design work that every site changes the design of the system. So we need to find a site and then we start design with 30% of the design. And as it was mentioned to us yesterday, that design really will even get down to the horsepower of motors needed to do the work. So it's really cut about 80% of the work for 600,000.
I guess we just got the proposal on that yesterday too. And the various tasks and budget outlined, so we haven't even had a chance to review it. We're gonna. So anyway, we're just strictly looking for a recommendation at this time to utilize HDR based on the request for qualification, response for the request for qualifications with the state.
Are you okay with that? Absolutely.
So is there a motion for recommendation to move forward with HDR as a?
May I make a
selected-
comment?
Oh, sorry, I didn't, sure.
Oh, thank you. I just want to explain why I'm going to abstain on this vote. And it's for the same reason that I abstained on the first phase of this. And I sent you all an email that explains it in a little more detail. I'm just going to quickly say that, taking advantage of the so-called free stuff is the reason for hyperinflation that is going to make life very difficult for all but the very wealthy. And I wish to avoid contributing to this problem. So that's the reason for my abstaining. Thank you.
Thank you for your comment, Dr. Bukacek. With that, I'd like to refer to Ron Lee because I think we've had discussion before on the appropriateness of the state abstaining versus voting otherwise.
So according to Robert's rules, we don't have to require somebody to vote. Abstaining from voting is the same as not voting at all or voting no. If you're abstaining because of a conflict of interest, like what we saw earlier when Artis stepped out because the motion that we were about to have on the action item that we were about to have had a conflict with the business that she was in, that's an appropriate use of abstaining. If you're abstaining because of not having enough information, it's kind of, according to Robert's rules, that's part of the process of being on a board, is to get as much information so that you can make government decisions.
Thank you. I appreciate that clarification. So it's my understanding if somebody is to abstain on this type of situation, then that's basically a no vote.
Okay, and I would prefer to vote no. I was trying to be polite. So I would feel in better conscience if I voted no. So I'm happy to do that.
I just wanted to clarify that. Thank you, Ron. Appreciate your insight. Okay, so
If I recall your words, not exactly, I would move to adopt them in the motion to proceed.
So if there is a motion to proceed with selecting HDR as the consultant, engineering design consultant for the Flathead County septic treatment and biosolids composting facility.
So just to clarify, then the motion is to then enter into for the commissioners then to go forward with entering into contract with them.
Yeah, so we could include, if you want to include that as an amendment.
That's my understanding.
Yeah, okay, I just wanted, I think I'm just clarifying that motion.
I'll make a second on that.
Okay, it's been moved and been seconded to proceed with HDR. Janelle, would you do a roll
Can
call?
we have a discussion? I do have
Oh,
a couple
yeah,
questions
sure.
after the motion, no worries. Just for point of clarification, the $600,000 that is expected for this phase one, which includes site and design work for the project. The project, I'm going to ask staff a question to just kind of in this discussion time, let us know the project is so that we can address something that we've been kind of kicking down the road for a very long time. And that if we do not address this, whether we use ARPA funds or we use an additional taxing of our community, or we go and ask for something to be put on the ballot for us to tax the community, is this a project that we have to now address because of the lack of land for the septic?
My professional opinion is yes. And I'll give you a little elucidation. We've watched, this board has dealt with septic near homes in the past. Literally complaints that septic is being put on the ground way too close to homes. We do a lot of complaint investigations around the septic land disposal that we do now. And we're losing land at a remarkable rate in Flathead County. And we all know that based on all the subdivision activity that we have going on. We have one septic pumper right now that is going out of business and selling his equipment to someone who still has land. This has been going on for several years. This is something we started 8 years ago looking at, and it continues to become more and more of a problem all the time. My feeling is if we don't move now, we will find ourselves wondering where septic is going to be disposed of in 5 years. This is not a project that's going to take a year. This is going to be a multi-year project to get this thing built, figure out how it's going to be run. There's a lot to this. If we start now, we could be 3 years before we can receive septic. That's a long time in an area that has seen astronomical growth in Montana. So my opinion, I want to continue to express that, but this has been my opinion for a long time. My opinion is that we need to act now. I've had legislators say that, this is money that we'll never see again. And if we're going to do anything with this money, we should do it for the community's benefit. And I firmly believe a project like that is of the community's benefit. Step.
And Mr. Chair, I have one other question. Along those lines, if we don't address it, I'm not sure if this goes to you or to the county commissioner on the board. If we don't address it now and we look at it in 5 years, are we going to be able to come up with a solution? Will we be able to do an infill on the problems that we're going to be facing if we don't address it now? And then are we the only community in Montana that's facing this problem?
Why don't you address politics and I'll address
Oh, perfect. As much as ARPA funds are what they are, and many of us agree or don't agree with what the federal government is doing, I, for one, don't agree with all the spending that's going on. But at the end of the day, this decision was made in DC to put out some ARPA funds for basically wastewater, sewer, water, wastewater, and broadband. It's basically all there is. For the county, we're not into water, sewer, broadband, really. As a city, of course, cities are, they have their own sewer systems, they have their own water system, they have all that. So the county's a little bit limited on what they can do with this money that we've been allocated. So at the end of the day, yeah, we've been talking about this for 8-10 years or more, about this problem that we have going forward. So I look at this as an opportunity to do something with funds that were allocated by someone else, whether I agree or not, to better our community. And without these funds, this would never get done. As Joe said, where are we going to throw the septic when they shut down the land? Are we going to haul it somewhere? I mean, it's going to cost $2,000 to have your septic pumped if we don't move forward and have somewhere to put this stuff. So I think it's an opportunity that comes along that we will not get again. So yeah, to your point, this is something that the taxpayer, we don't want to put on the taxpayer back. We have some funds to do it. I think it's a good project going forward. It's not like we dreamt this up yesterday. We've been talking about it a long time. So it's a good project. I fully support it. I think I brought it to the board 8 years ago that this needed to get done, and I'm excited. We have some funds finally to look at it seriously. So I'm excited about the project.
So I might add to that a little bit too. So this project was submitted to the DNRC and it ranked, I believe, 7th out of 100 and some plus projects. So it was ranked very, very high by the DNRC. The other issues with continued land application include just the potential for groundwater contamination. It's becoming more of an environmental concern. And I think with this, we're kind of looking forward, just like the Flathead County Solid Waste District does. They continue to buy surrounding properties as they become available for that to allow for their expansion, which is keeping an eye to the future, which is a great idea. And so we're sort of in the same situation as that we're looking for land now so that we can make this happen in the future.
The only other technical aspect to this that I mentioned, there are municipalities that receive septic. But if you know Flathead County, we have 30,000 septic tanks. It is how we have developed Flathead County. Other communities, the limited amount of rural development they've had, Lewis and Clark, Cascade County, if you've been there, you know, there's not that much out there. But those municipal wastewater treatment plants can manage a little bit. Our development has driven us to need more of a septic facility for that. We generate 16,000 gallons of septic a day. 16,000 gallons a day. And all of the regulatory constraints, and Roger knows this way better than I do, that have been put on municipal wastewater treatment plants. This is a high strength waste, it's extra water, and they're all fighting between the development of 55 homes, which is what this will generate a day, and the fact that we would take up that from the community. Our municipalities are going to be great partners in this. We've had talks with everyone, but they can take it, and we can do it right. And we can be one of the communities in a high groundwater, high surface water area that does it right and doesn't cause any additional pollution of our groundwater.
And I would just share from Kalispell's perspective, you know, we've sort of looked at this issue. I'm not sure how Columbia Falls has looked at this issue, but we were only looking at the composting side of this. And so I do think that when we were able to back out putting a composting facility that Kalispell was going to build, put into ratepayers having to pay for that. And I think there's an opportunity here to see how we could regionally be working together and benefit the cities and the county, and then also address the larger septic issue, which is something I got educated on once we had the proposal. So I think that there's an opportunity of just coordinated cost savings.
Okay, thank you for the discussion. Any further questions?
May I say something further?
Certainly.
Thank you, appreciate it. You know, and I know that elected and unelected government officials, they always justify their projects and justify getting more of the free money. I mean, I understand all that, and that's what's put us further and further in debt. And I would encourage all of you to at least listen to the first 10 minutes of what I sent you, a link to Texas Representative Chip Roy talking about this. I mean, the whole 47 minutes are excellent, but the first 10 it'll help you understand better my position. One of the commenters said that this is not going to be on the taxpayers' back, and that is not true. We all pay federal taxes, and besides that, you know, kind of the insidious tax, if you will, when we get hyperinflation, when regular folks can't afford to feed their families and have a roof over their head, that, you know, this fancy system we're going to be developing isn't really going to mean very much to them. They're going to have a real tough time with this hyperinflation, even making ends meet. So I would just ask you to please listen to at least the first 10 minutes of the Honorable Representative Chip Roy. We just raised our debt ceiling of this nation by trillions of dollars. And I think y'all need to understand what that's going to do to our future.
That those families will struggle when they have to pay $2,000 to empty their septic tank. That won't help them either.
So I think,
Food and shelter, food and shelter.
appreciate your comment, Dr. Bukacek. The other flip side of this too is that this money, if we decline to take it, it'll go to another entity, be it another Montana county or city or something. So it's not that it's not gonna go back into the federal coffers. It's there. We have an opportunity there. So.
Right, I know, and it's not as though my one vote is gonna matter, but it's just on principle, and I think sometimes a person and committees need to vote on principle as well, so, but I understand what you're saying, Roger.
Right.
Pam, you had a comment?
Right. I just wanted to add to that, I totally agree with what Roger just said. We didn't make the decision to allocate the funds. That was made back in Washington DC. And I know you think that we just make excuses for spending the money, but this is, like I said earlier, this isn't something we just dreamt up yesterday. This is something we've been working on for years. And it's to benefit our community and to help our taxpayers, frankly. We pay a lot of money into the federal government, and a lot of times we don't get a lot of it back. So to get this back, again, we didn't vote to allocate, but it's been allocated, and if we can better the community, then I see we help our community, and it doesn't go to some other community because it's going somewhere. So that was it.
I understand all those arguments, and I've been hearing them for the last 10 years, and we're going further and further in debt, so I understand.
Right. So maybe we have to make some changes in DC.
Well, that's beyond our control.
The motion before us.
Okay.
But what we do here is under our control, so.
We have a
Thank you.
motion in front of the board right now, with that. Now, could we have a roll call vote, please?
Artis,
Yes.
Annie,
No,
Bill,
Yes?
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronaldine.
Yes,
Thank you. So the motion's been approved to recommend HDR for the biosolids contractor. With that, we're moving on to department reports. First one is the finance committee. Kurt, good to see you.
Good to see you. Good afternoon. So this report is for November. General health fund looking good, about 1.1 million versus 1.2 a year ago. We had tax revenue about 720,000 was collected in November, and we'll get another little bit here in December also. But it's the same story with the immunization clinic and environmental health, sort of the same statistics. EH again, just doing really well. Capital improvements, Earl Bennett Building AC chiller contract has been finalized, and it's in process, expected to be delivered in May approximately and installed. Moving on, home health, cash balance, negative 58,000, down a little bit since October. AR balance 330,000. And if you want to look at page 4, you can see over time up to the right-hand side there towards the bottom, the average cash balance, sort of the trend there a little bit. And if you look at sort of the bottom left, cash net accounts receivable about 238,000. So dropping off a little bit there. That's total assets with the accounts receivable and cash in total. And sort of to detail all that, if go to page 5. Page 5 is a graph of revenue and expenses here, and you can sort of see the trend over the last year. Expenses have sort of held in there relatively flat, but revenue, there was in January a switch over in billing came in-house from
out of house, so that's, you see that big V there to a certain extent, but that sort of got smoothed out if you would average those out, but overall the trend down a little bit, so. That also leads into the next page here of, on page 6. There's 3 lines. The orange one is the cash line, so that just is representative of the cash balance, and this is over the last year too. And then the maroon line is the accounts receivable balance. The blue line is the combination of both. And so, you know, receivables can go up, but cash goes down, so that as you book business, you know, your receivables go up, and then as you collect them, then of course that balance comes back down. And so if you combine both of them there, you looked at the total AR and cash was relatively level for a period of time. And then starting about June, those total assets have started to decline a little bit. And on page 7, you can sort of see why that is. This is a graph of visits, referrals, and the census for the home health department. And starting in June, visits and the census have dropped off and has since rebounded, which is good. But expenses have been relatively consistent, but revenue, depending on the situation with census and so on, affects the cash balance overall. So if you take that hit every once in a while, that cash balance gets a little bit lower and lower. Cheryl and Chris have been doing a great job of trying to reduce expenses and go out and collect the accounts receivable. They're doing a yeoman's job of getting that done. And so if you see the census is moving back up, so that's down at the bottom there, but you see the census on page 7 starting to move back up and recovery, which is a good sign. And as long as it stays up and it's consistent, then we've sort of bottomed out and I expect cash to bottom out. But that's as long as census and those collections are keep happening. But I imagine the model of home health too has the hospital absorb some of the independent clinics and things out there. I don't know, Cheryl can probably talk a little bit more about that. I don't know if the model of home health gets a little bit tougher, but so that's just a little information on where home health is at currently. Are there any questions on the financials for home health?
The term census, what does that mean? Are those patients currently being seen or the
Yes,
number,
I imagine that's so.
Yes.
or the number of visits?
Number of visits has changed.
Patient encounters.
Yeah, patient census per patient. So like today we have 60.
Why was it so low in June and July?
Well, part of that is they don't want to be homebound. One of the requirements for home health is for them to be homebound. The weather's nice, they can get out, the families want to take them out, so they don't. That goes hand in hand. You see that in the summer consistently. The other part I was going to explain, we had to change our delivery or care base. I'm sorry. I'm Cheryl, for those of you who don't know me. I've worked for the agency since 1996 as an RN case manager. Took a few years off to get my kids born and came back as a case manager again, became clinical manager in 2009. Then I became partner with Courtney and Paul in 2016. And then our friend Courtney is gone now. She's moved on to Portland. So there I am. And so I've decided to cut costs. I'm doing the clinical manager role as well as the administrator role. Save that clinic. I've been doing it long enough. I can do both, and we're small enough, unfortunately. But what I wanted to explain is on the visits. So you look there in June and July. Courtney had always handled the business end of things, and I handled the clinical. When she left, obviously I started tackling the business end of things, and became clear to me that in 2020, the PDGM payment model came into effect. And what we should have done then was change our delivery of care, and that really didn't happen. So the PDGM model, so we get a 60-day period of care that we're allowed to give. Basically, now with PDGM model, we're able to see how much we're anticipated to get paid, and we need to use our visits accordingly. And so what was happening was we were giving free care away, and so that has stopped very dramatically. Scrutinized very heavily. It's sad for the patients, but it's what we have to do to survive. And the staff have had a very difficult time adjusting to that, but we're good now.
Can you translate that for me? Does that mean fewer visits
Yes.
for the same money?
Less money. But what was happening, they weren't adjusting the visits in comparison to what we're getting paid for. So we were giving free care. So you're paying all the staff wages and all that kind of stuff. And so I think when you look at it and see what was going on, that was a big factor. So we've changed that. So now you're getting compensated for everything you do. Does that make sense?
I sense that's pretty close to what I said. Is it materially different? I said fewer visits to the same
Right.
number of patients, so you weren't getting paid for everything that you did.
Correct.
Right. So you're doing fewer visits
Yes.
and getting paid essentially the same amount.
Yes.
Okay. You're not giving away free care.
Exactly. Exactly. So that's partly why you're going to see that dip in June, July. And then you're running into the summer factor. People don't want to be homebound, are able to get out, which we always encourage them to go out if they can. They're always healthier if they can get out. But yeah, I know referrals are definitely an issue. I harass the hospitals quite often, let them know we've got room. You know, I'm very polite. I'm friends with most people there. I say, hey, we've got room, we can take referrals. We're up to 60 today. And so that's enough to keep us working. We also don't have as many staff. In June, we had a few retire, few move. And we are not utilizing the PRN staff, the as needed staff as much. I'm trying to get more bang for the buck from full timers, and that's going quite well. It also allows the care managers to see their patients primarily, which means they're going to be more efficient with the care. They're going to be more on top of the care they're giving them, instead of having the assistants kind of sub in between visits. So that's making it better as well. But referrals are, you know, we're the underdog. So we've done some marketing. For the most part, the marketing that works for our geriatric clinic is actually in print form or in person form. And they don't do social media much, you know, their families might hear there, but they usually will call us. And so that goes pretty well, word of mouth. We're very heavy in the assisted living is the other thing, which is very fortunate. They like us. They have been closed down quite a bit because of COVID. So that also is a reason for the limited visits, the reduction of visits. Initially, they were not letting nursing even come in. Now they are letting the nurses come in, but not the therapists. So now we just heard today that well life is quarantined. So that limits our visits as well.
Roger, if you don't mind that. So Cheryl and I met a while ago, and I really do believe that you have a really good plan going forward. Started the year with the change in pay or how we paid, certainly didn't help.
Yeah.
We've been through this, Bill, and you've reduced your fixed costs.
Yes, tremendously.
So the variable cost should really follow your census at that point. So I think you've done a lot of really good things, and I hold out hope that we're going to start to see this thing go in the right direction. I keep telling Kurt that.
I actually got word today that from Chris, he's our biller, and he's, you know, been doing it for about a year, so he's learning. And Katie came over And Kurt has been a tremendous help and Joe as well. And so he just informed me today, as of December 1st, he's collected 61 plus thousand. And there's another 22,000 en route that's confirmed, which brings up to 83, and that's today. So I think we're starting to, and then my best news, we were given the bill for our software, and that was going to be another $20,000 gig. So I've been negotiating with them this morning. They let me know that they would lower to 4178. So that'll be, so as far as big things coming up, I don't know of any in the near future. So I think we eliminated the match on the 401k. We eliminated the flex plan. We've made a lot of cost cutting. And our supplies have gone down significantly as well, because I've taken that over as far as the ordering. So I'm hoping our staff is really solid.
I think some of the things that have been done will really help the program. But realize, we get high acuity patients in here, we get low payers. It's just the way that we've worked, and that means that Cheryl's worked to get our census up. So somewhere in there, with these fixed costs, if they don't have to go up based on census, we will get to a point where it's like the 70% hospital fill really makes it break even, right? So we're going to get to that point. We probably need to get the census up a little bit.
Yeah, I mean, I think it'd be better to be in the 70s for sure. I think I feel more confident.
I just think that we want you, as the board, your responsibility is to the fiscal nature of this. We want you to be aware, but you also need to know that Kirk and I and Cheryl, we're working hard to make this thing work.
I'm pleased to hear that. I'm a way concerned. You're the only one that has more seniority than I do here. And I know Pam is just one behind me, and I know that's been your concern for a long time. We've shared that, but I'm pleased to hear what's going on.
Yeah. I mean,
And for the new markers have been going on, we focused on the big hospital, not getting us our share, and that's true. But I hope you could get more patients out of them. Down in the past.
Yeah, we get a lot of our patients from those little entities, and really the assistants are.
If the press is listening, I hope I see this on the daily,
Yeah,
tomorrow.
yeah, we need the referral. So there are plenty of patients out there, I think, for all of us.
Any further questions for Sharon?
Sharon, your staff has done an amazing job, and it sounds like there's been a lot of sacrifice.
Yes.
And I just want to recognize that.
Oh, thank you.
And appreciate the amount of sacrifice and dedication for a very vulnerable part of our population.
Oh, thank you.
And so it's much appreciated.
Happy to pass that on. They all work really hard. They're very cordial about the changes. Yeah, they will do whatever they can. They're happy to have their jobs. They know they're good jobs. So yeah, thank you.
Any other questions, comments, or either Kurt or Cheryl? Thanks, guys. Appreciate the update. Yeah. All right. So environmental.
Good afternoon, board. First of all, I want to thank Bill for your service on this board. It's been over 12 years, Bill, and I appreciate your dedication to public health. Best of luck to you, and I've seen you around Whitefish at some of the plays, and just look forward to seeing you again.
Well, thank you.
And Kyle, thank you for your service too. I haven't really worked much with you, but what I've seen. I do have a few sanitarians here that I want to introduce. They work in our land program, and I'm going to let them introduce themselves.
Hello, my name is Fred Wolkers. I grew up in Great Falls, Montana. Went to school at Carroll College in Helena. Graduated coming up 10 years now. Still relatively young. Started with the county a year ago, and as a sanitarian in training, and got my registered sanitarian license August, so 4 months ago, and learning a lot. Really lucky to learn from some really good people like Kate Cassidy, Wendy, and having Joe Russell around. So just learning a lot. And,
Thank you, see.
Hello, good to meet everybody and put faces to the names, those of you that I haven't met. My name is Crystal Kyle, and I started in May, late May, so I'm still pretty new. Working as a sanitarian and training currently, but I take my test next week, so hopefully I'll get my RS. I've got a degree in geology, graduated from Oregon State University with a focus in hydrology, so working in the land program is important to me. I've always been an advocate of clean water, so I'm happy to be able to be a part of providing and protecting our waters for our community.
Yeah, well, sounds like a couple great additions.
Yeah, they are. Got some other people and they're smart and they're go-getters.
Yeah,
So.
great. So what does that mean for you?
Not so, thanks, Russ. So you can see on our diagram there that we have just, kind of status quo in the septic program and land. We've all seen that in the development in Flathead County in the last few years. So, we're lucky that we've got these two people coming up and they're learning. And then another thing I wanted to bring up, and I don't have a slide on this, is their food and consumer program. On your cooperative agreement, on one of those pages, it talks about percent of fees that we get from the state. So currently, on all of our food and consumer programs, which is their retail foods, the small and the large restaurants, manufacturing, pools, spas, public accommodations, we are at over 90% inspected. So we will get all of our fees from the state this year. So we strive every year looking at our lists and like what do we need to hit. So we're over that 90% on all of our food and consumer program licenses. Just for a little information here on the tourist homes, I think last time I talked with you about our tourist homes, we have almost 900 licensed in this county. I'm sure there's plenty more out there that are not coming forth. But there's a lot out there, and they're time consuming too. Other than that,
Just, I want to make a point on Kate's comment, Roger, if you don't mind. When we talk about 90%, a restaurant that's high risk is inspected multiple times in a year. We only get counted for the one. By the statute, we only have to do one. The board has made the decision that we would be a risk-based inspection program. So if we said there were 900 inspections due, we'll have done 1,400. But it's the 90% is trying to capture those little food retail smalls that get licensed as a mobile and they never operate, or we can't ever track them down. And we got a plan a couple of weeks ago that we can still use the COVID guys to call them up and still get an inspection counted. So that's where we're going to get to it. But realize the board, we do risk-based inspections. So a restaurant, full service restaurants get 2 or 3 inspections a year. We only get counted.
and then our compliance inspections too that will show up. And they've got, very good to see. So we're back there doing another inspection within a few weeks. So we do have a sanitary position open right now. We had a gal last month resign, so we're looking for that. If anybody knows anybody wanting to come work with my group. One thing I did get an email this morning from Court Harris from Glacier Park International Airport that their design went to DEQ. They're waiting for approval on that expansion. there as of mid-September, so Springfield's able to handle right now what's being. And that's about all I've got. Anybody have any questions on environmental health and where we're at? Okay, thank you.
I would think say, it doesn't look like your septic and subdivision applications have diminished any.
No, that's, yeah.
Very high volume.
Well, kind of waiting for some more cold weather to come in and a lot of snow. Thanks on that, Roger.
Yeah, well, and I want to extend our appreciation for you continuing to stick around, training and mentoring the new employees.
Yeah, and
Thank you
I
much
want
for
to
that.
get these guys trained up so they're ready to go. Thank you.
Thanks.
All right, to the health officer.
Okay, Roger. Hold up. You've seen these slides before, indications are good. National level information that says we're going to spike, but they said it last year and we didn't. So if you look at prevalence of disease, we're under 200 cases, which means when you look at prevalence, that's the active cases, and that's basically the last 10 days. And we're running, I reported on the day 13th, we were at 147 active cases. So things are going in the right direction. I want to hope that they stay that way. Interesting that our positivity rate is down below 10 again, which is really good for long-term care facilities because they don't have to do the level of testing that is required when our positivity rates jump over 10. So always nice that they can relax a little bit. They don't get to relax a lot, but they do. We continue to see our percent immunized with first dose, adding 7,500 new people in the 5 to 11 cohort. We're at 49% of basically one out of every 2 people have had a vaccine. Breakthrough cases continue to alarm me. It's over 20% of all cases are fully immunized. It's the way this Delta variant works, pretty aggressive. We're seeing that a lot. Weekly vaccination rates. We're doing a bunch of that activity at the fairgrounds. We can't hardly read on this, but we did 2,500 doses last month, primarily at the fairgrounds and then Wednesday afternoons here for the pediatric clinics. And census is going down. The last 4 days, North Valley's had no COVID cases. North Valley has had no COVID cases. So we're seeing it going in the right direction. I will mention, because this is something that a board member brought up to my attention. I looked at the census data today. Of the 16 that are in, 16 or 15 that are in, we have 3 that are vaccinated. So we have 3 breakthrough cases out of 15 in the hospital. None of them are in intermediate or intensive care. So that's good stuff. Cooperative agreement, I used this time to give my little spiel in front of this. So the cooperative agreement was done. The MOU has been delivered. It was actually mentioned by Jeff Larson that he wants me to send that to the director. I just sent it to the program director for subdivisions. And then the last thing is, I won't read it verbatim, but I do want to, I hope you all read my other letters to the board. I really do want to thank, first of all, I want to thank Bill, who I've had an opportunity, I took 4 years off, but I had an opportunity to work before I retired and now that I came back. You've done a lot of heavy lifting for the board and I do appreciate everything you've missed.
We didn't talk about the ones I had to let you and drop, so
No, you didn't.
got a few of those.
You didn't drop much, but thanks for what you did. Kyle, I knew I get to work with a good person when I knew your mom and how great a person she was. So Vivian is a great lady and I knew that it was going to be a good year that I get to work with you. Thank you for your service to the board and to the community of Kalispell. And Jess, I know you're out there somewhere, but Another one good year. I love her background. I cannot express enough. When you get a veterinarian with a master of public health, you get a gem. And I personally get to work with a lot of DVMs within PHs around the country. A lot of them are my teaching colleagues, and they're rock solid public health people. So we got a good year, and maybe we'll see her again sometime. Time will tell. But thank you so much for what you've done for the board and for my year back. I'll be here, but that's okay. Not really. Oh, and wait, I got a resolution. Did you see that? To all board members, thanks for an exciting year, understated. I hope the new year comes and finds Flathead County a new health officer. Make it your resolution. That's it.
All right, thank you, Jeff.
May I ask a question? Do either of you know whether Whitefish is nominated?
They're gonna wait till the January meeting.
That's what I thought.
I think they're taking some applications. I don't know if it'll be a counselor or if it will be just a community person.
I talked to the city manager, one counselor and the mayor for the last couple of days. Communicated to all of them, said that there's nobody better that we all know about than Jessica. And that I didn't insult anybody about what I would call them if they don't for you, but that's my feeling. And they all reacted positive. So I hope that she's back there.
All right, with that, thank you, Joe, for your report. So I guess, yeah, just follow along on this board member discussion. I want to extend, I have only been on 1 or 2 terms. Appreciate Bill and everything you've done. Your accounting background's been great. That's a great dimension to the board. And same with Kyle, your insights and whatnot. Really enjoyed working with you. So, both you guys will be missed. So with that, that's my comments. Everybody happy holidays.
Can we discuss the behavioral health committee?
Oh.
I know you're moving on with that, but.
We're out of here. Sorry.
No worries. I mean, I do think that we've talked a little bit, Ron Lee and I have had a couple of meetings about a behavioral health committee. I do think it would be beneficial for the board to be knowing what that behavioral health work, but really for the community to also know where that behavioral health work is. The idea that Ron Lee and I have discussed what you could have as a committee is one, reestablishing some of the work and priorities that were sort of we've seen pre-COVID, so 2019 sort of priorities. So one of those that's dear and important to me is like reestablishing a suicide prevention grant, being able to get into that conversation that the community is having. But I also, in doing some research and just in talking with agencies and people who are out there in the community, I'm worried about the community approaching behavioral health and us recreating some silos that happen because some conversations happen in Kalispell that don't happen in the Cole County. Some conversations happen in Whitefish. And this is a community-wide issue. And I do think that this is a good space for us to convene in that. And I'll just note my last other important reason is I've been running across some agencies and people who don't know about like Jeremy Delrude's new position. So they're still dealing with the fact that we've had some staff attrition, lost Holly George historically, who's been a community leader in that. And we actually have somebody who's picking up that work and actually been doing that work, but I'm not sure it's being raised up enough. So I would encourage us to do that. And I think Ronald Lee was interested in maybe being able to chair a committee on behavioral health.
Continue the conversation. We did outline in our last behavioral health committee some ways of looking at some priorities. We came up with 3 that would be actionable items that we can continue to report back to the full board and move forward with those communications with stakeholders, not just members, but stakeholders in behavioral health and mental health, and talking to the schools and bringing that bridge back.
Roger, just to tag on this. The commissioners, I'd like to make sure that our committee, we really link in with the commissioners, because the commissioners manage alcohol tax money and distribute that, and there is some need to possibly do a request for qualification this year. I would hope the board could participate in that. And we also provide about $96,000 of mental health money to an agency that's continually failing. And I really think that the board and the expertise that we do lend can really help the commissioners office out and how that money is spent. And I hope you take that on, because I think it's really good work that we're more suited to do than any other board in the county. Just
I have a further comment to that. Yesterday, the finance committee to the, I can't remember the name, but it used to be a CHC, which is over there upstairs. We get the patient counters, the patient encounter every month. But the reason is, and also who pays the bill. So the number of people involved in the health issue that you're talking about is now 20% of the total encounters. So it is a major issue, and it certainly merits more attention. So I agree. Go for it.
So as somebody who's coming off of the board, I mean, I would hope that we could do it. Do we want to entertain a motion to establish the committee, or?
Your choice. Right.
So I move that the Flathead City County Health Board establish a behavioral health committee to address the support of staff and reestablishing funding for the Flathead behavioral health system.
I'll second the motion.
Any discussion about the motion to establish a behavioral health committee?
And as part of the discussion, I know that Kyle, Jess, and I have been working on this after we had a board meeting that is starting to show that we have not given the focus to the impacts of what's happening in our community. And as we see Kyle and Jess rolling off, I'm willing to step up and lead in that committee for the board.
So, move the second to establish a behavioral health committee. Let's have a roll call on this.
Artis,
Yes.
Annie,
Yes,
Bill,
Yes.
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronaldine.
Yes.
Great. So I guess you will be the chair. We will be appointing members or volunteers.
I exuberantly volunteer to be on that behavioral health committee. I would enjoy that very much.
Thank you for your,
I have quite a bit of expertise in it, so.
great. Okay, with that, I guess, Kyle,
May I make a comment?
we're going around the board first here.
Oh, okay.
So, Kyle, do you have anything?
Sure. It has been an honor to work with all of you. I mean, I think that, the last couple of years, and COVID in particular, has been really a lot of political decisions about how much we keep the community open and how do we maintain public health. I think we've made some pretty good decisions over the course of the last 2 years. They've been challenging. But something that I'm going to also step up down on is being your chair of your personnel committee. And I think that that is the responsibility of the board as you reestablish and get into that search, fulfilling Joe's resolution there, that we do need to find some stability for the board, for the public health board, but also how to, you'll end up needing to, I would propose that you would reestablish a new personnel committee. It does look like you'll need to hire and interview a new headhunter, and that would give an opportunity for new board members to join in to have some of that community conversation of really starting that process from the ground up. So hopefully be able to successfully secure a new health officer. You have done the big changes, which is we have the job description done and you've done a salary arrangement. So I think that in the first quarter of next year, you'll be in good hands to be able to do that. And I look forward to your success in being able to recruit a new health officer, but also to help us reestablish trust within the health board and be able to get our priorities when it comes down to all aspects of public health. So thank you. It's been great to be able to work with all of us.
Thank you, John. We'll so sorely miss your participation. Dr. Agor.
Yeah, thank you. Again, thank you, Bill, Kyle, and Jess for being on the board and learned a lot from each of the three of you. And so thank you for your service. And again, you'll be missed. And also thanks today to Ron Lee for just a reminder on decorum and how we should conduct ourselves. Thank you for that reminder from Robert's rules. And I would just encourage us all as we go into our next the term this upcoming year that would be how we would continue to conduct ourselves. That we even disagreements occur, that we will continue to treat each other respectfully, and so appreciate that. And finally, thank you to the commissioners for the opportunity to serve a full term coming up. So thank you for the trust that you put in me to do that, and I will promise to continue to repay that trust with hard work and thoughtful input. So thank you.
Thank you. I guess I pretty much said my piece. I want to just acknowledge Pam and the county commissioners for reappointing Riley and Dr. Taylor. I think it's really important to have that institutional knowledge. It really helps to streamline decisions during the board meetings. So, Mr. Burr.
Oh, so formal. Lots been said. Let me echo your comments. Everybody so forth. It's been a long period, 9 years, but too short. Which leads me to relate a conversation, multiple conversations I've had over the last week, 10 days, particularly after the announcement of the commissioners. It's a bittersweet departure. People actually don't get, and I responded, but let me paint a picture of it. You're driving down the highway, four-lane highway or 5-lane. If it's 4, it's being reduced to 2 lanes because of the Columbia Falls and Whitefish, or it's 5 going to 3. And this is before I knew that I thought you had foregone. And I said, well, if I was the commissioners, I'd rate myself number 4 or number 3 of these conversations. And then when I saw the results, it'd be number 4. I reached that conclusion based on, I've been here for 9 years. You folks are anywhere from 10 to 20 years younger than I, maybe 30 years younger than I am. You've been to bring a different perspective, which is important. And you've done a good job, really good job, particularly in something we started a couple years ago, was expanding the committees. To do the heavy lifting in committee with people who have subject matter knowledge. That's the 2 people on the environment. And you came back several times with a better solution than was proposed. I think we did that in the early days of the COVID committee. I like the decision we just made for an important new committee. And I think it makes our board better and is more collegial as a result. Recommendations to get better. We have one commissioner here all the time. I think it would be helpful to us and the commissioners to have at every meeting, one of the other 2 commissioners here just to see how we make decisions. I'm very proud of the way we do it. I think some of the difficulties we had in the past, particularly last year, is we collectively, and particularly me, I didn't know the commissioners other than Pam. And they didn't know any of us, they didn't know me at all. And that led to a very unfortunate use of terms with, by me, in relation to the Commissioner Phil. I think it was accurate what I said, it was misconstrued. But it would have been better understood if we had a better relationship that started at zero. So I applaud the committees, and there's a way of perhaps bringing the commissioners in the group. I mentioned before here about Jessica. Again, I talked to 3 people, and I know some of you communicated with the mayor, city managers, or members of the council. That she, in spite of me being a persona non grata there, for a totally different reason, they're all accepted in one group. So you make logical sense. I'm changing just a little bit. I'm on the Habitat Committee. Recently, we had a selected family, a mom and a single mom and 2 kids, who violated the terms of the agreement that we built her a custom-made house. And she was deselected. The house is under construction. They stopped and put it on a couple of adjacent houses in the same area. So there is a parent and 2 kids that work. It's partially completed. If you know anybody in your department, this department upstairs or in the county. A young couple with young kids, doesn't have to be a young couple, it'd be an older couple. There is a house partially constructed that needs a new tenant. If you know anybody, absolutely contact Habitat. And finally, this weekend is the holiday weekend for the symphony. There are a lot of empty seats. It's Saturday night and Sunday afternoon, 3 o'clock, 7:30 Saturday, 3 o'clock. And I can give away Thursday, and I will have number of tickets. We have 2 new people here. I'll reserve the first 2 for that. It's the holiday pops. There's a little bit of classical music that has become popular. Like many of the Disney cartoons that had to be played. Classic, that's focused on Christmas and here. If you like, we pass for 2 people and a limited number of unruly kids. I'll give you a pass away to so thank you for the opportunity to serve and be part of this group.
Well, I, of course, want to thank all the members that have been serving this board through the COVID and then Jessica too. We didn't really got on the tail of it. But any of the board members that are leaving, I just want to thank you for your service. You know, I think it's been great. We've worked well together, you know, and I appreciate your service to the county. And thank you for that. I wish you all the best wherever that goes. I also want to welcome back a couple of incumbents. I don't know why they would want to do this again, but they applied. So it's been quite a journey here the last few years, and so hopefully we're on the tail end of it, and we're going to move into some exciting things going on this year. You know, there's way more than COVID out there, and I think the health board does a lot of things that people don't even realize. So I think our focus should be just moving towards some, you know, better things and just moving on. So thank you for reapplying and coming back. I also want to welcome the new members. I know we have 1 here still, and we've got 1 having a new grandkid, which I totally appreciate. And whoever likes this, you know, welcome to the board. Again, we've got a lot of work ahead of us, and looking forward to an exciting year. And I also want to wish everybody a Merry Christmas and a great New Year. And I think we're going to be good year next year.
Well, I'm going to continue to echo the thank you to the board members who've served through very difficult and challenging times. And I thank you for your service. It's been an honor to serve with you. I welcome the new board members, and I look forward to the exciting opportunity to work with new ideas and new thoughtful approaches. I thought about the challenge for the resolution, and it actually challenged me to remember why I originally applied that first time my letter of interest to be a member of the health board. And it's because I have a strong care and passion to serve the most vulnerable in our community. And that's from the senior citizens to the single families to those who are struggling and falling through the cracks. And it just challenged me to focus on what I want to accomplish in the next 3 years. And that is to refocus and look at how do we go from where we were through COVID and into continuing to serve our community. So I thank the commissioners for entrusting me to continue in service. I thank our community for the support and for the continued public comments. I appreciate hearing from people what they are passionate and concerned about, because it really does matter. Merry Christmas.
Last but not least.
No, Annie.
Oh, Annie.
I want to thank Kyle and Bill for all the time and effort you guys had put on this board and kind of educated me with things I didn't know much about. And so, and then Jessica, she was a good asset, and hopefully she'll be back soon. So, but I want to thank you guys and my fellow board members as well. So, and Merry Christmas.
Thank you. Dr. Bukichak.
All right. I appreciate the opportunity. The first citizen commenter, Hannah, she eloquently presented views that I think represent many, if not most, in our community. And I took some notes and would like to comment on some of the things that she said. Roger, you were very kind and respectful and honored Hannah, her well-organized, cogent, and concise speech, and you let her talk beyond the 3 minutes. And you've been, I just want to thank you, Roger. You've been very respectful to the citizens that take the time to come and present their views. So wanted to thank you for that. One of the things Hannah stated was that everyone here on the board has signed an oath to the U.S. Constitution and have often broken that oath. More and more of the public are waking up to some of the facts that Hannah spoke about. And one of them I've brought up before, the government causes a problem, then comes in with the expensive program, White Horse, and tells us that their programs will fix the problem that they've created. Another thing Hannah stated was the COVID, I don't remember what you called it, but rollout or fiasco, it served to concentrate power and resources into the hands of individuals, corporations, and government entities that do not have our best interests in mind. And I think a lot of people in the community would agree with that. The restrictions of the COVID rollout brought rancorous division to our community, trashed the free economy, forced senior citizens to languish lonely in long-term care facilities for the second year in a row. No Christmas caroling for those poor people locked down there under the guise of protecting them. So I really think I have a pretty good finger on the pulse of this community, and many share Hannah's belief that the CDC has lied to us. And to quote Robert F. Kennedy Jr., quote, "The CDC is not an independent agency, it is a vaccine company. The CDC owns over 20 vaccine patents. It sells almost $4.6 billion of vaccines every year," end of quote. And I'm almost done. The credibility of county health departments and my beloved medical profession is at an all-time low. If we as a health department continue to uncritically follow CDC guidelines, we will never win back the confidence of these knowledgeable citizens. And I understand the desire to move past COVID, and certainly there are other things the health department does, but in my opinion, just like somebody abusive who never makes things right, we can't really get past it and help the community heal until we first acknowledge, our fault in the damage that has happened, and then strive to do better and win back their confidence. That's it.
Thank you, Dr. Bukichak.
Thank you all very much.
With that, I move that we adjourn the meeting. Merry Christmas.
Thank you. Merry Christmas.
Point of clarification,